Hello, my name is Dr. King. I wanted to answer some questions you may have about prolotherapy. Prolotherapy is a process that stimulates your own body's healing response. The goal of prolotherapy is to pretty much get you out of pain. There's a couple of different mediums that we use for prolotherapy. The most common is called PRP. PRP stands for platelet-rich plasma. The process is where we actually take your blood, we spin it, we get the platelets and growth factors, and we use that medium to actually inject back into your joints to initiate the healing response. The other most common type of prolotherapy is called dextrose prolotherapy. Dextrose is a sugar that we actually inject into your joints. The goal of that is to recruit platelets and growth factors to the area, to the joint that we're specifically treating. So PRP compared to dextrose, the big difference is PRP actually has the growth factors and dextrose recruits your own body's growth factors. I also utilize something called ozone when I do my injections. Ozone is a gas. The goal of using ozone is to speed up the healing process and to really put oxygen into the tendons and ligaments. Big reason why patients have pain is because the tendons and ligaments are weak and loose, and then the muscles start tightening because of the structure of the tendons and ligaments are not actually strong and holding the joint together. So the whole goal of prolotherapy is to strengthen those tendons and ligaments so that you can get out of pain. I recommend using PRP treatments when patients have a pain level of 5 or higher on a scale of 1 to 10, 10 being the most. And then patients that have lower level of pain, like maybe 4 and under, I'd recommend using a dextrose treatment. The amount of treatments does vary between both of them. Usually PRP treatments, we would do 1 treatment every 3 to 4 weeks for a session of about 3 treatments. With dextrose, we might do a couple more treatments, so up to 5 treatments in about the 3 to 4 week time span. I recommend patients send me any type of imaging they have, like MRIs or X-rays, just so I can review it, just to be more prepared to give my recommendations. A lot of people ask me, are the injections painful? And everyone's pain tolerance is so different, so some people experience more pain than others. I would say most people anticipate the pain being a lot more than what it actually is once we start doing the injections. Right after the injections, you're probably going to feel a little bit of numbness and fullness. There isn't going to be a significant improvement directly after. I recommend patients just take it easy for the next couple days. Don't try to do anything strenuous. Like if it's a knee, don't do anything for lower body. If it's a shoulder, you can, go running and everything, but don't do anything for the upper body. So just depending on where you're at with what joint we're treating. Mostly patients will feel better at the 3rd day, and then I recommend patients to actually start doing their regular daily activities and actually exercising on their 3rd day, depending on pain tolerance. So if your pain is still pretty high on the 3rd day, then you want to take it easy. But if you're feeling better and you're starting to get strength and your pain has gone down, then you can start getting back to the gym and doing your regular exercise routine. I've had patients have results the next day. I've had patients take 6 to 8 weeks before they start seeing better results. Most of the time, patients will get 20 to 30% improvement after each treatment. So that's why I recommend 2 to 3 treatments spaced about a month apart. I have about an 80% success rate with treating patients, and I'd be happy to share this success with you.